Over the last decade, we've seen the issues of addiction, homelessness, and public safety grow and affect every community in Alberta, with our major centres of Calgary and Edmonton being no exception, but I see it as well in Lethbridge, Medicine Hat, and Wetaskiwin, and other places across the province. We've been taking immediate action to address these social issues through the recently appointed public safety and community response task forces in both of our major urban centres of Calgary and Edmonton. Each task force includes 4 cabinet ministers, city officials, Indigenous voices, in addition to police, fire, and EMS, all working together to implement $187 million in new funding from the province to address these issues. This includes the creation of the following things in our major centers: new recovery communities, increased medical detox and pre-treatment capacity. Just last week, you may have seen, the task force announced the drop-in center here in Calgary will create 35 detox and pre-treatment beds capable of supporting 1,000 Calgarians every year. A new police health hub model where police and health services will work hand in hand, build harm reduction and recovery outreach teams, and also will be implementing addiction and mental health treatment programs in correctional centers. In order to effectively tackle addiction, we need to work together across sectors. And these teams have our government's full support to make Calgary and Edmonton safer and healthier for everyone. It's clear that now is the time to continue moving forward and to continue investing in our system of care for Albertans. And to accomplish this, I'm pleased to announce here at the Alberta Recovery Conference that next week our government will table a budget which will include record-breaking investments to a comprehensive mental health and addiction care system. In 2019, when we came to office, the mental health and addiction-specific budget was only about $87 million a year. Next year alone, if passed, Budget 2023 will provide $275 million in funding for the Ministry of Mental Health and Addiction. This record-breaking investment would be used to focus on key priorities, including increasing our harm reduction programs, Indigenous partnerships, further increasing access to treatment and recovery supports, helping children and youth improve their mental health, partnering with first responders to keep communities safe while treating mental health and addiction compassionately. And as many of you know, our government is building for the future of Alberta with new next-generation treatment facilities called recovery communities. Now, recovery communities are holistic, long-term facilities where people have the time and the support they need to work not only on recovery, but on every part of their lives. With 6 already underway, including one in Red Deer that's about to welcome its first residents, Budget 2023 would bring the total number of newly constructed recovery communities to 9, with an additional $75 million in capital funding to put 3 new projects on the books. This will bring the total investment for building new recovery communities to over $200 million, with projects planned in Calgary, in Edmonton, the North Zone, the Central Zone, and the Calgary Zone. And I'm proud to say that these projects will start coming into operation this year with the completion of the Red Deer Recovery Community, the Lethbridge Recovery Community, and the Gun Recovery Community. And lastly, one of the projects that I'm most proud of is the recovery community that we've been building in partnership with the Blood Tribe in southern Alberta. It's got a very unique design that's going to also incorporate not only sort of modern treatment methods, but also some of the traditional healing methods. And we hope that becomes a model that we can make sure that we expand to other nations in the province. When we say recovery is possible, there are some of us that tell us that we have unreasonable expectations. Critics say that recovery is not an achievable or even a realistic goal. But what they fail to understand is this: when we say recovery is possible, we're providing hope and optimism to people who are often living without any hope. We're saying that you can recover and there is a better life for you that you deserve and that we will be there for you. On top of that, we're saying that we're going to build a system of care that actually gives everyone in Alberta a real opportunity to begin and be supported in that pursuit. I'm proud to say that we've refused to accept the status quo in Alberta. We rejected the idea that the system we inherited from the previous government is the best we could do. We dared to set higher expectations, and we've made significant progress toward achieving them. We are well on our way to having systems of care where recovery and wellness is possible for everyone.